You were being dispatched to a motor vehicle accident for a 30-year-old man who was ejected from a motor vehicle.
30-year-old male ejected from a motor vehicle. Okay. All right. PPE is the or BSI is scene safe.
BSI noted, and the scene is safe.
Okay. Mechanism of injury is a ejection from a motor vehicle accident.
That's correct.
This is my only patient.
This is the only patient.
I'm going to call ALS at this time.
Being dispatched.
I'm also going to have my partner hold and maintain C-spine.
Okay.
Okay. General impression: I see a 30-year-old male lying unresponsive, supine on the ground.
Yes, you see a 30-year-old male lying about 30 feet from a motor vehicle in the position that you see before you.
Okay. Is there any major life threats that I can see?
You do see spurting blood from the right lower leg.
From the right lower leg. Okay. All right. I'm going to apply trauma dressing and pressure. Does that stop the bleeding?
It does not stop the bleeding.
Okay. More pressure and dressings. Does that stop the bleeding?
It does not.
Okay. I'm going to apply a tourniquet, proximal femur, and note the time.
Okay.
Okay. Is there anything else that I see?
No other apparent life threats.
Okay. All right. I'm going to check for responsiveness. Sir, can you hear me?
No response.
No response. Any response to painful stimuli?
When you pinch his trap, you get a brief eye opening and some moaning.
Okay. Eye opening and moaning. He's got a GCS of 5, and he has a P on the APU scale.
Okay.
And you said there's no other major life threats I need to be concerned about?
No other life threats.
Okay. All right. I'm going to have my partner use the jaw thrust maneuver to open the airway.
Okay.
I'm going to insert an OPA due to his GCS of 5.
All right.
Does the patient accept?
He accepts the OPA. There is no gag reflex.
Okay, perfect. All right, I'm going to expose the chest. Do I see anything on the chest?
When you expose the chest, you see a puncture wound to the right upper chest.
Right upper chest, okay. I'm going to apply a 3-sided occlusive dressing.
Okay.
All right, I'm going to also auscultate for lung sounds.
Okay. Lung sounds are decreased on the right and normal on the left.
Okay. I'm also going to look, listen, and feel for breathing. Can I get a respiratory rate, character, and quality?
Okay. Respiratory rate is 16 with a good tidal volume.
Okay.
And your lung sounds are decreased on the right and normal on the left.
Okay. All right. I'm going to check for a pulse.
Okay. Patient has a carotid pulse of 90.
Okay, 90 carotid pulse. I'm going to check the skin color.
It's pale, cool, diaphoretic.
Okay, I'm going to apply a blanket for shock as well as O2 via a non-rebreather, 15 liters per minute.
Okay.
I'm also going to, is there any other major bleeding?
No other major bleeding.
Okay. Based on his GCS of 5, I want to transport him to a level 1 or 2 trauma center.
Alright. You're not a transport unit, but one is on the way.
Okay. All right, I'm going to perform a rapid scan of my patient. I'm going to check the head. Any drainage from the ears?
No drainage from the ears.
Okay. Is the airway still clear?
Airway still clear.
Okay. I'm going to apply a C-collar. Yeah. And I'm going to check for JVD, tracheal deviation, or cervical step-offs.
No JVD, no tracheal deviation, and no step-offs are noted.
Okay. I'm going to check the chest for rigidity.
Chest wall appears stable.
Okay. Flanks.
We're good.
Okay. Pubis.
Stable.
Okay. I'm going to check the pelvis for crepitus. And I'm checking the entire body for TCAP BTLS.
Okay. And that stands for?
Deformities, contusions, abrasions, punctures, penetrations, tenderness, lacerations, and swelling.
Okay. The pelvis appears to be stable.
Okay. Left femur, right tib fib, right femur, and right tib fib.
So the right tib fib
Besides the injury.
has the injury that you already found.
Yep. Gonna do the left humerus, left radial ulna.
Are clear?
Right humerus, right radial ulna.
Right radialis and ulna appear to have a deformity.
Okay. All right. That's noted on that injury. Since most of the injuries are on his right side, I'm going to roll him to his uninjured side.
Okay.
Okay. So on my partner's count for C-spine, we're going to roll the patient over.
1, 2, 3.
Okay. And check the back of the skull. Check the neck.
Okay.
His back.
Back is clear.
Check the buttocks for incontinence. And check the left femur, left tib fib, right femur, right tib fib.
Okay, all those areas are unremarkable.
Okay. We're going to roll him back onto a backboard, 5 straps, and a headbed.
Okay.
Okay. We're going to roll on my partner's count.
1, 2, 3.
Okay. All right. Is there a sample history that I can obtain? Is there anything in his wallet? Any bystanders that saw anything?
Unfortunately, there are no bystanders. There is no sample history available.
Okay. I'm going to perform a detailed scan of my patient.
Okay.
So frontal, parietal, occipital, temporal. Check the orbits. Check the eyes for pearl. I want to check the ears for drainage.
No drainage.
All right. Any battle signs?
No battle signs.
Okay. I'm going to check the zygomas, maxilla, mandible.
All clear.
Check the airway.
Airway is good.
So clear. Again, JVD, cervical step-offs, and tracheal deviation.
No step-offs, tracheal deviation, or JVD.
Okay. Check the clavicles.
Clavicles are intact.
Okay. Check the chest for stability.
Chest is
rigidity.
stable.
All right. I'm going to oscillate for lung sounds again.
Okay. Lung sounds are decreased still on the right and normal on the left.
Okay. Check the abdomen. Do I see anything?
No,
Normal.
abdomen is unremarkable.
Okay. I'm going to palpate all 4.
All 4 quadrants are soft and non-tender.
Okay. Again, checking the flanks as well.
Flanks are clear.
Pubis. Checking the genitals for priapism, incontinence.
No priapism or incontinence.
Bleeding. Okay. Checking the pelvis again for stability.
Pelvis is stable.
Left femur. Left tib fib.
Are all clear.
Right femur. And besides the injury on the right tib fib.
Otherwise unremarkable.
Okay. And check for pedal pulses and PMS.
Pedal pulses are absent on the right. They are present, or sorry, absent on the left. Absent on the right, present on the left, and PMS is reduced.
Okay. I'm going to check the left humerus, left radius ulna, right humerus, right radius ulna.
Right radius and ulna appear to be deformed.
Okay. And check for pedal pulses, or not pedal pulses, I'm sorry. And check for radial pulses, and I'm going to check for PMS.
Radial pulses are present, and PMS is present bilaterally.
Okay. I'm going to, can I get some vitals on my patient?
Your patient has a blood pressure of 140/80, a heart rate of 90, and a respiratory rate of 16.
Okay. I'm going to manage my patient's secondary injuries,
Which are what?
which are the puncture wound, and he's also got the deformity on his right radius ulna.
Okay, and how are you going to manage that?
He is on a he's got 3-sided occlusive dressing on his chest, and he's on a long board right now to provide stabilization.
Okay.
So I'm going to recheck my patient, reassess every 5 minutes on his for his vital signs, his ABCs, and ABCs and his secondary injuries. Yeah, that's it.
Okay.
This completes my station.
All right.